Wait, wait. Hi, my name's Ian Madison. My student number is 001-00653T. I'm doing CERT 4 for massage, and I'm doing the assessment today for confirmed physical health status, practical assessment, PA1, client history and vital signs. And my student I'm working with today is Eddie Sue.
Yeah, hey there.
Has filled out his client case history form for me, and we'll just run through a few questions on that. Now, so Eddie, can I just confirm your date of birth?
For the May 92.
Okay, that makes you 21 this year. Fantastic. And you show that you're come to see me for a hip, leg or foot injury.
Yeah, it's actually my hamstrings.
Oh, your hamstrings?
Yeah, hamstrings, yeah.
What happened?
Basically, I think I played badminton like last week, and I think I pulled my muscles. So,
oh, okay.
Yeah,
right. Do you play badminton often?
Yeah, 3-4 times a week.
Okay, right, so you're playing competition.
Yeah.
Oh, terrific. What happened when you hurt yourself? What did you do next?
Just put ice on top of it for 20 on and 20 off.
Okay, so you did that for a while, or just once?
Just like for an hour.
For an hour,
yeah.
Okay. And did you find some relief?
Yeah, they feel better after that.
Great, okay. And then what did you do after that?
I went to see my GP just for precautions. Yeah, I went to see my GP, and my GP did some X-ray and some MRI scan.
Right.
And there's no sign of any tissue tears or what, so she just advised me to come and see. Yeah.
Come see me for massage?
Yeah.
Oh, that's terrific. You've had massage treatment before?
Yeah.
And you had no trouble with me touching your body. You're aware that you might have to drop down to your underwear perhaps when I'm working on you. That's all fine, terrific. You've had no surgery. Have you had any other injury with badminton on your legs at all?
Not at this stage, just my right.
Okay, that's great. So we've got that, and it says that it's affected your badminton training.
Yeah, definitely. It's a bit awkward when you work. Usually when you are in the car, it's a bit awkward.
Okay, all right.
Very uncomfortable position. So. Okay.
Are you back training again now?
Yeah, just rest for a couple of days at the moment.
Okay. So you say you've got a little bit of tightness there.
Yeah. And
you've got a pain is at a 6. Is that now or when you did it?
You can feel the pain whenever you move like strong, like you work hard on your right leg, and you feel the pain.
Okay. So apart from the ice, which stopped the severe initial pain and swelling, that's all you've done?
Yeah.
Okay. I see that you've read the declaration here.
Yeah.
And you understand that?
Yep.
And I have signed the declaration and you signed the declaration.
Yep. Okay,
thanks very much. I'm just going to start with some health assessment now, and we'll move on from there.
Okay.
So today we're going to start with taking Eddie's temperature. I have the thermometer and alcohol swab. I'll just clean the alcohol swab over the thermometer there. Switch it on, and I'll get Eddie's pipe down his tongue and just leave it there, and we'll just wait for the reading. We're just checking Eddie's vital signs to show that he's not affected by fever or he's not suffering like an illness. His blood pressure is fine, temperature is fine, his breathing and respiration is okay. So as long as it's within limits, and then we get a true reading of his current state of health. Thank you. That's terrific. And that we have is 36.9, and the normal temperature for human beings is 37. So he's right on the scope there. Well done, Eddie. I'm just going to take Eddie's pulse now. I'm going to take it for 30 seconds, and then multiply that by 2, which will give me the pulse over a minute. Okay, so that's 35 for half a minute, and by 2, that's 70. Within the normal range of the pulse, that's 72 beats per minute, so 70 beats per minute falls within the healthy range there. What I'm going to do at the same time is, so Eddie doesn't know, I'm actually going to count his breathing, his respiratory rate. But without him knowing, because if he knows I'm counting his breaths, the human being has a tendency to speed up or slow down the breath, so they become quite conscious for a minute actually, so we get a proper count, and I'll just count his breaths. He doesn't know that I'm actually counting his breaths, he thinks that I'm actually still holding for his pulse. Okay, and with that I have a count of 18 breaths per minute, and of course the breathing, he's just at the higher end of the scope, it still falls within that, and for a healthy male he has 18 breaths per minute, which fits inside the threshold there. What we're going to do now is take his blood pressure. And if you don't mind, how's that? Right. I'll just pop the stethoscope on, and what I'll do is turn it clockwise, pop it up to 160. I'll just pop this here, pop it up to 160, and let it out slowly. That showed 115 over 75, which also fits inside the healthy envelope there. So I'll just make a note of that as well. The desirable rate for a healthy male is between 90 and 119. over 60 to 79. Thanks, Eddie. So Eddie, I appreciate that your GP has sent you to see me, and just to let you know that I can only work within my scope of practice. I'm not here to diagnose anything. I'm here just to observe and then form a treatment plan for you from what I observe. If I feel that there's an injury that you have that was greater than my scope of practice, I'll perhaps refer you to a physiotherapist or a chiropractor. And do I have your permission to contact your GP just to let him know what I've observed and then what my recommendations are?
Yeah, definitely.
Terrific. Just with the hamstrings, a little bit of anatomy for you is it's made up of three parts: the semimembranosus, semitendinosus, and the bicep femoris. They're involved in the knee flexion and the hip extension. They're the anterior part of the thigh, as you know, and inferior to the glutes. In the act of walking, they act as an antagonist to the quadricep group in the deacceleration of the knee extension. And the hamstring injuries, as you might be aware, happens a lot to athletes, and that's of course what you are. As sports people, runners, football players, rugby players, cyclists, and it's often caused by a few different reasons. So are you happy with what we've done today?
Oh yeah, definitely. Yeah.
What I'll do is I'll direct you to the next room, which is the treatment room, and I'll see you in there.
Okay.
Thanks very much.
Yes, see you.